Hello, Dr. Ellen Cutler here. And this is for those of you who are going to do your ECM clearing at home on you or a family member and learning how to do it so that it works. And based on what you've been recommended, how many times a day you should do it or when you do it, this is the method to do the ECM clearing, or the correction is what I call it. And I'm going to just use this little skeleton, this little body to give you an idea, instructions how to do it too. If there's any question, please, you can always call our clinic or look online for other ways to learn and improve on the technique. But it usually is very, very effective. So first thing is you're going to be getting a vial that will have the signature of the clearing that you're going to be doing. And you can put it on the person. They can hold it in their hand. Child, they can put it in a sock or diaper or whatever, okay? As long as it's on their body. And what you're going to do, the first thing you're going to do is with your knife edge of your hand, you're going to go down the spine like this, all the way down the whole spine. And you don't have to be exact. It will work no matter what, okay? And what you're going to do is you can have the person, and for infants or little kids, they can't do it, or animals, they can't really do this, but otherwise, adults, you can definitely do it. They have them take a deep breath and hold, and you go down and up, and then let it out and hold, and you're going to go down and up, and then they're going to pant. You go down the whole spine, just like that. Very gentle, doesn't have to be forceful. It's, I know sometimes clients will say, my mom or dad does it too hard. No, it's gentle. Okay, so you go inhale, exhale, pant, and then relax. And you're going to do that twice. So do it again. Inhale, let it out, and pant, and relax. Good. Okay, that's the first thing. And then you're going to have them hum and count 2, 3, 4. So you get all sides of the brain, right and left sides of the brains, and different expressions or motions of the body. It can be cleared through. Okay, so inhale, exhale, and hum and count, and then relax, just normal. Okay, and then you're going to have them, just their eyes, not their head, look down to the right, and you're going to go down and up, and look down to the left, down and up, and then rotate their eyes, if they can, to the right, clockwise, and up, and counterclockwise. And that is the clearing. Now, if you really want to learn more about ECM, you can learn the muscle test too. And you can actually learn, because you can see if they've cleared. So let's say you put this specific thing in their hand, and you can try this with anything. Most people are sensitive to sugar or artificial sugar. Put it in their hand, and you can do a muscle test. And you push down, and you'll see that it'll go weak. So if you put their vial in there, and you use their muscle, and it's out in front in a right angle, and you push down, and it's weak, that means they are sensitive. It's not cleared. We want to get them strong. So you keep doing it until the arm is strong. And it really will feel like a lock. There shouldn't be any give in it at all. And to learn more about it, I talk about this in my books as well, too. And I will do more on some muscle testing teach, because there's lots of different ways. You can use the O-ring test for that. You can actually do a little muscle like that, okay? And I do different ones too that will, test, muscle test. People have all kinds of different ones, but you can learn how to do this, okay? Or I do this. It's once you get it, it's so wonderful, because you can test things. You can go in the cosmetic and look at something, a cosmetic, and see if you're actually sensitive. If you're sensitive, wouldn't want to buy it because it might give you some problems. Okay, so again, that's it. Inhale, exhale, pant, relax. Do that twice. Hum, count, hum again, and then relax and look down to the right, look down to the left, rotate to the right, rotate. And this is on their back, on their spine. Okay, gentle. Don't do the neck because I'm always afraid you're going to hurt. So do it right below the neck. It'll work. Okay. Now, what happens if you don't have anyone to do that to you? Okay. So I also developed other ways that do the clearing. You can hold it and just do different points that you can do. And one of them is just on your hand, between your thumb and your second finger, and then around your elbow too. You can see that here. Okay. And you can do the same thing here. And then on the elbow. Okay. And then another point is right below the clavicle. You can do that. Some of these are EFT points that you can use too. You can use some of these too. Okay. And there. And then right above the pubic bone as well. You can see you can do points in there too as well. But the most important ones are here and here and here, and then keep doing it. So these will take maybe 15. You want to hold the thing for at least 20 minutes too. And you can do different points here too, and here as well. And sometimes people will do a point above their ankle as well too that you can rub and bend. These are different meridian points too also that will give it. But most important are these, and just keep doing them. And sometimes people even feel that they've cleared, that they've cleared these particular sensitivities. And then you test and do the muscle test and see if it works too as well. Some people will get a little hanger and kind of do their back if they want, or a bonga we used to sell, but they're not important. You can literally do your hand. Some people like to do that anyway, again, for the different points too, okay? And you can do all the different points there that work. Even on your head, there's one too. So I hope this helps. Again, these are people that are going to do some of the clearings or the desensitization at home. People are going to work with me. I'm going to take on a few clients every year, and you do them every 6 months, and these people are going to learn, because they're not going to be me doing it on them. They're going to learn to do them themselves, and we'll go over it. But this is a video, so you'll have to be able to get the instruction and learn. If there's any question, just call our clinic, and we will help you with any kind of misunderstanding or anything you don't quite understand relative to how the clearing works. So good luck. And I also recommend, maybe if it's a food that you're really sensitive, wait a day or so before you eat it, just to and test it, make sure you're strong. And again, you want to do these clearings, and I will, or your practitioner will tell you how many times you should do it before you go on and get tested and do another clearing. But I would say maybe keep doing it for 10 days, every day, once or twice a day. The more you do it, the better. And you will see the changes. And remember to take your digestive enzyme. That's very important. Thank you.